the postpartum period is an extra special time in life where so much is happening in your body and it can feel like a black hole in your health, meaning there's no conversation around really what to expect with your body, what kind of support you can be getting. And basically, you're left with a 6-week visit that is just clearing you for activity and leaving you wondering what you should do with your body, when to actually be recovered or not. That's why this week we're talking with two of the founders of Mone Wellness. That's Dr. Kate Hum and Coach Savannah Miller. We're talking about how you can take an integrative and functional approach to postpartum and what to really look for, and they team to assemble to really have the best support and thrive through postpartum and into motherhood. I love this conversation. We touch on a lot of different aspects, even just the cultural aspects of being postpartum and the kind of support we get or don't get. I think we bust a lot of myths with this conversation, as well as really talk about what should be normal and what is just common. So if you are going into the postpartum period, if you're newly postpartum, I think you'll get a lot of really great insights from this conversation and hopefully feel just a little bit more heard, a little bit more understood, and be able to give yourself so much grace as you're moving through this transition. All right. Well, Dr. Kate Hum and Savannah Miller, thank you so much for both being here with me today.
Thank you so much for having us. We're grateful to be here.
Yeah. Before we dive in, I'd love to start with, can you share a bit about just what got you into the postpartum care space?
Sure. I think our society really underestimates postpartum. We have a wealth of resources for women in fertility and pregnancy, but not a lot that I found in postpartum. And in my training in OB/GYN residency, we don't really talk much about postpartum, quite honestly. And everyone talks about their kind of perfect birth plan, and no one really talks about the post-birth plan. So I find it as a more of like a black hole in women's health, and it can often be overlooked, especially in the conventional medicine setting. And I think a lot of women are left to kind of just figure it out on their own. And what I see from more of an integrative medicine perspective lens is postpartum is such a critical time to set the foundation for long-term health and well-being. I think a very healthy, fulfilled mom is the foundation to building a very thriving family and community. But I think in the typical allopathic conventional medicine setting, we have a very fragmented postpartum system where mothers are left feeling unsupported and vulnerable, leaving the hospital with really limited education and direction. And specialties are often very split up and really unconnected for the providers that can support postpartum women, which I think leads to a lot of the mental health crises we have postpartum, the social needs that aren't addressed. And I think postpartum deserves just a really good guidance and support. It's such a life-changing experience. And micronutrient stores are depleted. And I think this is where integrative and functional medicine can really help women with hormonal balances, digestive functioning, micronutrient needs. So I felt we needed to build some sort of support system. So Coach Savannah, our co-founder Brooke, and I developed this phone app called Mone Wellness to help kind of serve as a guide for mothers on navigating the postpartum experience. So kind of fill that gap.
Amazing. I love how you sort of are reframing it from, not just being a black hole or kind of something like no one really knows to talk about or what to expect, especially going into our first pregnancy. I think when I talk to a lot of women, they either don't know at all what to expect or they're trying to prepare and they still don't really know how to best prepare. And I think I like that reframe of looking at it as a really big opportunity to support the mom, to build a foundation and really have it as this beautiful, nourishing space. I agree. I think there's so much more that we could do there. So that's amazing. And I think you perfectly kind of show that gap that's there in care. One of the things that's interesting to me is that we talk about postpartum as the fourth trimester. And there's a lot of traditional wisdom around postpartum, but still in the conventional system, it's like that 6-week visit and that's it. sort of this no man's land of getting actual support. It is very fragmented. So, I mean, what's your take on that?
I think there's like this idea that women should just bounce back after this 6 week mark and
Mm,
just because we have this 6 week postpartum checkup in allopathic medicine. And there is sort of like a historical significance to it because it marks the time the uterus usually fully involutes or goes back to its pre-pregnancy size. It's
mm,
a good time to kind of check on postpartum complications for vaginal tears or C-section incisions to make sure they're all healing properly. And it sort of marks the clearing for a patient for basic activity. But I think what's really important is women to know that it's not a point where your body's fully healed and you should feel ready or you should feel ready to have sex at the 6 week postpartum mark, and that your body's still recalibrating hormonally, and your pelvic floor and your core can also take like more than that, more than months, even up to a year to really gain strength and coordination. So I think it gives kind of women a false time point of postpartum where everything's just going to be fine and you should be back to normal, and this kind of overproductivity, I feel like, emphasis we have in society where women should just bounce back after having a baby, get back into society after that 6 month mark. And there's so much more involved in that. And I think a lot of women get frustrated or beat up themselves because they haven't reached that point. And I want to emphasize that it's usually like a year before your hormones kind of go back to normalizing postpartum. And you're not alone, and you have this, you can have support, and think, yeah.
And I think just like adding on to what you're saying, Kate, is something that we all talked about when we first kind of met and decided what demographic, we wanted to help. And postpartum women, like you mentioned earlier, it's such like an underserved, under talked about, incredibly difficult transition for a lot of women. And, like Kate mentioned, some of the stats, like physical recovery is realistically a minimum of like a year to 18 months. Emotional recovery is like, hormonal recovery is like 2 years. And, at birth, you lose like 500 to 1,000 mLs of blood. Like it's a major event, life event. And I feel like society puts, it in this glamour spotlight of, oh, baby's brought into the world, happy birthday. But a lot of the time, the mom is, in our opinion, underserved during this transition. And so we want to make it like the norm that it's okay to ask for help and also get the help you need in all these different branches of your life, because it's not just mental health, it's not just physical health, it's all these different things. Like you talk about, your environment, your relationships, your exposure. So I think trying to kind of pull all of those different pieces together in a way that can be helpful and useful to a mom on the go who's busy and wants, short snippets of information that she can implement into her life.
Yeah. Well, that's amazing. I think that's, amazing for women to hear. That probably blew some women's minds of, it can take up to 2 years. Maybe that sounds a little discouraging to some people, but, give yourself that patience and grace to let your body not even get back, but, be able to recover and get to a new normal, maybe. I think it is interesting that we have that 6 week visit. And as you mentioned, kind of like getting back into your normal routine, going back to work. We only have so long on disability. And so usually those time points are like, okay, well, 6 weeks, you're supposed to be back to quote unquote normal. And then, whatever it is, maybe like depending on your, work benefits and things like that. Once you go back to work, then, you should be back to work. You should be back to normal. You should be ready to leave your baby and all of that. And I think that is just so not the case for so many women. And we really struggle then when we're having a hard time focusing at work or feeling the energy for that, things like that. We're like, what's going on with me? And it really isn't the person's problem. It is the societal problem that it's just not talking about what's actually going on in a woman's body. Are there any other like big myths that you see and you're having to correct over and over again about the postpartum experience?
I guess going along with you're not meant to do this alone, and support, I think, is not optional in this time period. I think people, again, in our productivity driven society. And we're sort of, I feel like we take care of kids just in our single families, and traditionally that wasn't the case. You look at other cultures across the world and like India, Korea, China, and they have a completely different roadmap of how they raise their children and what postpartum recovery means, where it's more of like a structured support system and this almost confinement period where the community actually serves the postpartum woman with different rituals or practices. Versus I feel like women are just expected to kind of know it all after they leave the hospital and just like take care of it with their partners if they have one and just figure it out. And I think that's like a misconception. And that's not, I don't think that's how we were meant to be as humans.
Yeah, I agree with you. It's crazy to me. In other cultures, it can be such a beautiful transitional time where they have lots of support and a lot of focus about the mother, like you were speaking to before. In our society, it's also just this big focus. All of a sudden, you have the baby, and it's like, just take care of the baby. There really isn't,
Yeah.
much talk about caring for the mom, as much as there should be. And that's really what traditional cultures would do. They'd be caring for the mom during this entire time. So she's really not doing anything so she can recover also. So, yeah.
And with too, like the physical recovery, like you had mentioned, I think society paints this picture of like, okay, you have 3 weeks, you should be back full going. But a lot of social media, I think, portrays, these women doing these workouts, these core workouts, and it's very misleading, especially depending on your circumstance. So like everyone's birth was different, everyone's recovery is going to be different. So I think individualizing it and making it a norm for there not to be a norm, because everyone is different.
Yeah. What a great point. Yeah, I see those also. And it can make people crazy because there are women who are like 5 years postpartum and still have a little bit of a belly or something. And it's like, we're all created differently. We can't be doing this like comparison of before and afters and just expecting that we can have this like flat belly right away. And yeah, it just puts so much extra pressure on us for sure. And, that external rather than to focus on our internal that can oftentimes be really struggling too during this time to just like find our identity during this phase too.
Yes. I think there's a huge shift spiritually too, and partner dynamics is a huge topic I feel like we don't even discuss, and sexual health and postpartum too. Like, again, everything's going to be normal after 6 weeks. All that can drastically change for the rest of your life, going from like maiden to mother too, and you're kind of taking a more spiritual side of things and almost losing an identity is also an undiscussed thing as well.
Yeah. Yeah, even as we're talking about it, I'm just thinking about how moms in general kind of like, it's like this, we'll just fade into the background now because your kids are all that matter.
Yeah.
And women are, kind of supposed to be overachieving for their kids, like not don't take care of yourself, but only make things about your kids. And it really just starts with postpartum because it's like once they're born, okay, they're the star show. You keep them alive, but don't actually worry about yourself. And it's crazy because how are we expected to, live and thrive that way? With that too, we kind of mentioned the physical piece of healing and recovering. The mental aspect of postpartum can be really tough too. Are there some big areas that you think that you see a lot in terms of maybe, the actual like frank depression or baby blues, but also just with that transition areas that women aren't being supported the way they should or areas of opportunity?
I think nutrient depletion has a lot to do with depression and mental health in postpartum. About 30% of women experience some degree of postpartum depression in the year following birth. And I think the risk of maternal depression may increase due to the depletion of nutrient reserves. And I think vitamin D and omega-3s, when they're optimized, really there is some research showing how it could prevent maternal depression and how they can be incredibly beneficial for mental health. Vitamin D helps support your serotonin production. And then, I recommend various food sources and then supplementation. A lot of times I do in postpartum and in pregnancy. And then the omega-3, specifically DHA, it's key for baby's brain, nervous system, eyes, and really supports, in addition, the mental health aspect of it. And when I read the research with that and how conventional medicine doesn't even check omega-3 levels or vitamin D levels in pregnancy,
Mhm.
and how I think it was like the baby takes up about 67 milligrams per day of DHEA through the placenta in the last 3 months of pregnancy, and how that definitely gets depleted in breastfeeding. How much of a difference we can just by giving them a fish oil or a vitamin D drastically help their mental health. I was like, it blew my mind when I learned that. So I think that needs to be more emphasized in the conventional hospital setting more so. And it has to do with mental health, from my opinion.
Yeah. And piggybacking off of that, like same thing with just overall nutritional intake. Like if you're constantly low blood sugar or you're constantly fluctuating from high to low and it's not balanced throughout the day, that can affect mood, which can affect your sleep, which can affect your circadian rhythm, which is just kind of like that full everything's connected picture. And I think, mental health for postpartum women is often looked at and, okay, here's a medication, but it's not like, okay, well, let's look at your sleep. Let's look at your nutrition. Let's look at your environment. So I think like there's a lot of different factors which can be overwhelming, but also could bring you some peace knowing that there are different things you can work on and implement to make improvements.
Yeah, absolutely. Yeah, I feel like the mental health piece is very like common and over normalized a little bit. Like, oh
Mhm.
yeah, a lot of women go into postpartum again when I talk to them in pregnancy, they're worried about it ahead of time, but people aren't generally telling them, oh well, you could simply take an omega-3 and vitamin D and maybe hedge your bets a little bit, even if it isn't a guarantee. So that's such a great point that can be so empowering to take care of your nutrition. On that note, are there any other big nutritional gaps, like places where we're seeing a lot of nutritional deficiency in postpartum? I think the ones you mentioned already are huge ones in terms of omega-3 and vitamin D.
I think definitely iron as well, just from blood loss and delivery and increased demands, especially in breastfeeding. That can lead to a lot of the fatigue, the hair loss, poor wound healing, poor concentration. And so I think emphasizing that as well as magnesium really helps support relaxation and sleep and stress regulation. So I think deficiency in mag or iron can really lead to like anxiety and irritability symptoms. So those are additional ones I would recommend to emphasize.
Get to be on people's
Too
radars.
calcium. Doesn't it take like a year to replenish your calcium stores after pregnancy because the
Oh,
baby takes
yeah, that sounds about right.
their own
Mhm.
loss, which is
Mhm.
so crazy. Moms just give and give literally
Mhm.
everything.
Literally. Yeah, I feel like I say it over and over again to my patients. Like you literally created a human being out of your body.
Yes,
That didn't come out of nowhere. Like, yes, some came from your food, but it also largely came from your body. So you have to replete afterwards. Yeah. And with that too, I mean, even just like talking about caloric needs, I feel like that's
Mhm.
such a no man's land of, oh, well, you're not pregnant anymore and you're not trying to gain weight anymore. People trying to bounce back to this previous weight. But, what can you say about, you know, caloric intake or just like general nutritional intake, especially while we're breastfeeding?
Yeah. Do you want me to take this one, Kate?
Yeah, tell you.
I mean, our recommendations are obviously like 4 to 500 extra calories if you are breastfeeding. So a lot of the time that looks like 2,500 a day, but it's more like, especially with having worked with a lot of different women on their nutrition, instead of trying to hit a number, I think it's more feasible to try to just get small, frequent meals throughout the day when you can, prioritizing protein, prioritizing fiber, prioritizing calories where you can get them, and trying to like enhance a meal. So instead of just having crackers, have crackers with a hard boiled egg, have crackers with cheese. So like trying to get in where you can those calories, even if you're on the go, if you're breastfeeding, if you're, driving the kids somewhere. So I think a lot of it is like figuring out how to fit these snacks into your lifestyle, make it convenient, make it doable, because some women go in with like, oh my gosh, I have to hit this many calories, it's overwhelming, and they don't even get anywhere close to it, rather than just say, okay, I'm eating this typically at this time. How can I make this even better for myself? How can I enhance it and get more?
That's great. Yeah, nutrition can feel so overwhelming, especially with so many voices. Worrying from social media and things about food and nutrition, and a lot of people are trying to take care of themselves and their kids, and then they're worried about certain foods that are bad. And so that's a great point. Just like fit it in how you can.
Yeah.
Perfect always, but getting the nutrition how you can is going to be supportive. And what about some of the cultural things? We kind of touched on some of the cultural things in postpartum. Traditionally around food, things like warm foods, broths, organ meats, things like that. Is there anything to be said for those, or is it more of just like kind of cultural preference?
Yeah, I don't know if there's actual evidence-based randomized controlled trials as we know for those traditions, but I feel like just because it's been used for so many years and like just passed down from almost this like wise woman tradition from woman to woman. And like traditionally, when women were more midwives and kind of the main doctor for a lot of like tribes, I feel like that has something to say, you know? I think just from previous experience, and I think we should utilize those things. If it's not harmful and women feel supported in it and it creates a community atmosphere too and a bonding, I think there's so much benefit. I mean, yoni steaming is an example where as an OBGYN, like I'm pretty sure I'm the only OBGYN I know in the area that maybe promotes it in certain situations and especially in postpartum. And I think steam has like a beautiful way of like healing those tissues, but I don't think there's actual like evidence for it, but it's just been used in so many cultures. And yeah, I think there's a lot of that in medicine where I think I had a hard time when I first started in practice of just like utilizing those modalities. If it's not randomized control trial, we don't have anything like we shouldn't use it, like it might harm. But I'm starting to see, especially I've traveled a lot globally and worked with a lot of midwives, and they just show me their different traditions and their connections to botanicals and how that, I don't know, they just have a more like authentic connection to nature. And I think that heals drastically people's mental health as well and can really help in these like tough, vulnerable transitional times like perimenopause and postpartum where that's really needed. So I'm all about that.
Awesome.
Learning those things. I think like belly, you know, belly binding too is like a big thing they do in Asia. And there is some evidence with that with abdominal binders for C-sections post-op. But yeah, it's all about like the nourishing, warming foods and keeping that kind of area very like protected and not exposed to wind or kind of the environment. So I think it kind of goes along with the cultural message of just like protecting the postpartum woman in this vulnerable space, which is really beautiful, I think.
Yeah, that is beautiful. And I love how you bring up the point of like evidence-based is great. We love evidence-based, but sometimes there just isn't research done in a certain area. Pregnancy is a big area of this in general. So taking those traditional wisdoms and just knowing, like you said, if there's no risk to something, then, you know, or very low risk, then, you know, you can feel a lot safer in that. And especially if something's been used for so long. I think there is a lot of wisdom that we've lost, unfortunately. And there's a lot of wisdom in the earth that we don't utilize the way we could with like plant medicines and things. So, yeah.
Oh, I know. And I love seeing the research out with like how nature heals too, like the forest bathing and
Sleep and grounding.
that. Yeah, grounding exercises, you know. I feel like we're going backwards kind of. What evidence-based research is trying to catch up to like what we actually know intuitively, but
Yeah, we're trying to scientifically prove what's
yes,
known for centuries. Yeah, absolutely. Yeah, I mean, we like to act like we're separate from the earth, but
we
we're
do.
part of it. So, yeah. Well, to go back to nutrition a little bit, in terms of supplementation, are there any big areas that you're typically recommending? Like, is a prenatal enough? Is there more that's needed, usually beyond food?
Sorry, Kate, I didn't mean to interrupt.
No, you're in.
I'm gonna say typically my recommendations for like my nutrition clients are vitamin D, depending on what your levels say, because we know that we can dose that in a way where we can bring your levels to the optimal amount, which is typically 40 to 60, even though I think you get marked on a blood test if you're below 20 as being deficient. It might be 30 now, but we know that optimally it's like 40 to 60. I think it's nanoliters per deciliter or something. Yep. So it's amazing because it's such a huge nutrient. It acts as like a steroid hormone in your body and does all these different things from mood to gut health to immune system. And we can get it measured and we can dose accordingly based on what we want to get you at. And so I think vitamin D would probably be the first one that comes to my mind, omega-3. And then obviously, like depending on the mom's situation, if they're iron deficient, anemic, looking at, their lifestyle and their diet and kind of the big picture of what they could ideally supplement if they can't get from food. Because we know that obviously food is the best source, but then there's a lot of different factors that play a role in that also.
Yeah.
What would you say, Kate?
I agree. I keep everyone on a prenatal vitamin for at least a year. And then from like a functional medicine standpoint, I screen for kind of nutrient depletion, postpartum anemia, thyroid dysfunction, and then kind of go from there and sort of replete their vitamin D and omegas based on their lab levels. But
And you said a year after and a year before, or both?
Before they get pregnant,
Conceive, and then
yeah, I mean, ACOG talks about starting prenatal vitamins 3 months before conceiving actually helps prevent nausea and vomiting. So definitely at least 3 months before. But yeah, ultimately when I'm doing preconception visits, if they come to see me a year before they get pregnant, that's so great. I mean, start the prenatal. So
I agree with you, especially if it's a concurrent pregnancy, like they've already, again, created that human and lost those nutrients. Like,
I know.
I'm sort of in the camp of just stay on a prenatal while you're in your year. After your first kid, just keep staying on it because then you're prepared for the next one. You'll like maybe be less likely to be depleted after that one. So
yeah, no, I know. It gets tricky too when they're in their 40s and they want to have another baby. And I'm like, oh, you got to wait the 18 months. But you still like it. Yeah, it's like I feel like such an individualized discussion too with that. Wait, how long do you wait? But like when your ovarian is being depleted, like when's the right time to conceive again when you want your nutrients most depleted? So
yeah. To take it into movement, you talked a little bit about being cleared at 6 weeks for, movement in general, including sex. What would you actually recommend in terms of movement postpartum?
You want me to take this?
sure, I can add.
Well, I was just going to chime in and say it typically depends on the type of delivery they had and then how comfortable they feel. But starting off with just some simple movement exercises in bed can be so beneficial of just working on connecting your breathing with your body again and that core connection from your upper to lower body. I feel like those things can be started a little bit sooner if you obviously feel well and you don't have like certain circumstances that would contradict that. But yeah, what would you say, Kate? 6 weeks the mark for most vaginal deliveries?
It gets so individualized.
Yeah.
I don't like to make like a general statement. It's a really good question. Just because your pelvic floor is just connected to your abdominal muscles, your back muscles, your diaphragm, and they all work together and reinforce each other. And if one's weak, others will kind of pay the price. So I feel like we need to emphasize at least like the first week. I really emphasize kind of the lying in period and just like taking it super easy. And then the first 6 weeks after that, just like posture and breathing. And then kind of, I wish all my patients would have pelvic floor therapists to kind of fully assess their pelvic floor muscles and their core stability, and then kind of decide from there when they feel the best time to restart everything in the perfect world.
And with that too, I remember, like in the first few weeks, I remember hearing different sayings like bed for a week. I'm butchering this. And then like around the bed for a week and then around the house for a week or something like that. I remember hearing that, especially my first child. And I was like, but I'm feeling good enough. It's fine. I kind of just like went back at it to just go up and downstairs and things like that. You kind of mentioned maybe just staying in bed at first, or kind of like what do you usually recommend there?
It's tough because ACOG kind of recommends against doing this, but like traditionally in a lot of like traditional Chinese medicine and Ayurvedic cultures, there's like this 40 days of just like don't even do anything. So it's a good question. I kind of see also how the delivery went, like if they had pretty significant tears, was it a complicated C-section? How are they doing mentally? Do they have like the support at home? And kind of guide my recommendations based on all of that. And then probably involve a pelvic floor therapist just to kind of use a multidisciplinary team to kind of help when the specific guidance should be. But again, I think our culture just really emphasizes this bounce back mentality. So really emphasizing, I think, at least the first 1 or 2 weeks just to take it easy and just let everyone do everything for you. And at the most, like just walking around kind of the bedroom, maybe even not even going up and down the stairs. Just, I think we need to emphasize more rest in our culture. I feel like I'm always emphasizing that more so with my patients versus the other way around. So, yeah,
It's been
more
like
general
really
guidance.
it's been really interesting collaborating with pelvic floor specialists and some physical therapists that work in that realm, and they help rehab postpartum moms because we have had actually some of them create content for our app. And I'm watching this content as like a former D1 athlete and college coach that was like, all right, let's go, like hurry up type of a thing. And they're just such simple movements. It's literally them laying in bed, connecting their core with their breath, and just really slowing down, which I feel like will be a challenge for a lot of women to like look at that as like an not like an exercise, but a movement to try to work on is just literally 360 breathing, lifting your heel to your bottom while you're laying in bed flat, like things like that. Just try to reconnect your body. And it's so simple and so slow, but it's obviously so useful for a mom during this period of time because they shouldn't be doing a hit workout, on YouTube
Mhm.
their house.
Yeah. Yeah. Well, I mean, if you think about it, the remodeling that happened, like you said, this is such a big transition. Our body goes through this major remodeling over, a 24-hour period of, the baby being in your belly and then not being in your belly. And so all of those, like you mentioned, the pelvic floor being connected to the ab muscles and the back muscles, all of those muscles and tissues are like, what just happened? And so it makes sense that even just getting out of bed, even though it seems so simple, could be like our body could not be sure how to do that properly. So just getting back to the basics with breathing and connecting those back together makes a lot of sense.
Yeah, and they even brought up like how to carry your baby, how to hold your baby while you're sitting, your
Mm.
posture. So it's something to really be aware of. I think a lot of moms don't think, oh, I need to be careful how I do this or, rehab to be stronger in order to do this. But like you said, it's a huge transition and you're regrowing so many different things in your body from tissues to blood volume to everything. So
And I think it's also important to recognize relaxin in pregnancy rises. So it loosens your ligaments, softens your cervix, it allows your pelvis to expand for birth. And that drops after delivery, but not immediately. So it can be elevated for the first weeks to months postpartum. And when you breastfeed, it also can stay higher for longer. So it can really increase that joint laxity. Joints may feel less stable. There's a higher risk for kind of sprains or strains. There's reduced structural support. So again, just emphasizing delayed return to high impact activity, I think is important just physiologically. So
What a great reminder. Yeah. You might be feeling fine, but not that I would ever tell someone don't trust your body, but maybe keep in mind that your body's been through a lot and there are things that are not, back to normal yet. So that's good information. And with that, kind of just with taking a better approach then to all of these things, like what can someone do? We kind of mentioned, being on top of our diet and our movement, maybe checking some of those different things. Like what testing maybe would you recommend and kind of in what time frame postpartum?
Testing is for like functional medicine labs.
Yeah, yeah, or maybe basic or more functional. You mentioned things like checking vitamin D levels,
Yeah,
for example, and
definitely.
thyroid.
I would definitely check because I think that postpartum thyroiditis, which is an autoimmune condition where the thyroid gland basically becomes inflamed and it can happen within 1 year after pregnancy, is really missed a lot. So I definitely would emphasize doing thyroid labs in addition to the vitamin D and omega-3s. I think just overall, just asking about sleep and partner dynamics is really important in the history too for postpartum. Yeah, just asking about the support they have. You know, if you have a
Self
lab.
assessments on like different symptoms, bleeding, fatigue,
Yep.
sleep quality, mood. Because I think a lot of women like just are in survival mode, so they're just trying to get through each day and they're not really doing self check-ins throughout the day. It's actually like a difficult thing for a lot of women to do, is just be like, okay, let's take a minute. How am I feeling? How's my body? How was my sleep? Did I eat a balanced meal? And then obviously speaking with like their healthcare provider if things are atypical or they see patterns, which is actually what we like tried to do with the app. Was it will recognize patterns and like ping the user and say, hey, we noticed your mood's been down for 6 days and we noticed your sleep is down. So these two things can impact each other and these are ways to help it, etc., etc.
That's amazing. Yeah, I was going to ask, like, what are some of the, warning signs or red flags that someone should watch out for then? Because again, some of these things are maybe over normalized, where they're just like, oh, I'm feeling really down, but is that just part of it? Like, at what point should they, get more help? And it sounds like something like this app can be helpful for helping them understand that. But are there any big things that you'd flag for people too?
Yeah, we look at specifically like bleeding patterns as well. I mean, we're always looking for signs of preeclampsia, headaches, vision changes, right upper quadrant pain, big gastric pain, potentially blood pressure issues too. Signs of infection, if you've had a C-section, if the wound looks, there's discharge, there's redness, there's pain, as well as vaginal tears, looking for infection. Those are kind of like the big severe things. And then breastfeeding, there's mastitis we always want to watch out for. So any development of fever, I would say postpartum is concerning for some sort of infection of the breast or incision. And so we have that in the app where we monitor kind of like what you can do, common symptoms, what to expect, that they can log every day versus more severe symptoms. And if they have recurrent severe symptoms, it tells them that they should seek medical care right away.
That's great. That's so helpful. And it has the check-ins there too, it sounds like. So
Yes.
it's just tracking them. That's great.
And they can also print it out and give it to their provider because it's kind of like hard to keep track of everything when you're a first time mom. It's probably hard for anybody to keep track of like all their symptoms being newly postpartum.
Amazing. And what kind of support, like, are there certain times of support that you'd recommend doing things outside of just the visits? Again, like we mentioned the OB visit at 6 weeks or so, but are there also other things that you're generally recommending in terms of lactation support or pelvic PT, you kind of mentioned, things like that, and certain time frames and when you're thinking about those types of support?
I would say during your third trimester of pregnancy, start accumulating your postpartum tribe. That would be lactation specialist, pelvic floor therapist, who's going to be cooking your meals at home. I think those are like the big ones, I would say. Having some sort of reliable, somebody you can talk to mental health wise, having some good girlfriends that you can always turn to when you're having like a rough day. Honestly, doulas are amazing. All my patients could have doulas during pregnancy and postpartum, which I don't know if people know there's doulas postpartum as well that can support you through that time period. Those are my big support people for my patients.
Amazing. And it sounds like, even if maybe someone can't afford all of those, like a doula, night nurse, things like that, just then having someone like assemble your tribe of people who can support you and, you maybe do a meal train or have someone cooking, someone to do laundry, like really try to offload things as much as possible. Yeah.
I'm curious, did you have a meal train on your postpartum? And
For me, I didn't. Well,
okay.
no, I mean, we had people drop things by, but we didn't have an official train. Yeah, yeah. But my husband was on top of that. So yeah, but it was funny. It is interesting, because even, at the time of my first pregnancy, especially, I was already working with women and with fertility and things like that, but you still just don't really know. And going through it, we had all these people over at our house the first weekend. And I was like kind of going into entertaining mode. And like in retrospect, I was like, what was I doing? And so for our second one, we were sort of in lockdown then. We're just like, I mean, granted, it was soon after the pandemic too. But, we were just like, oh, wait, we realized for ourselves that we just needed a little bit more closed off, just our own, closer family. So yeah. And that can be part of it too, just kind of understanding yourself, I feel like, and knowing, okay, if this is going to be overwhelming to have a lot of people, then maybe pull back on that. Maybe they just drop things for the door and not, do more than that or something. But
Also, I think like a sexual health therapist too, want to add that in there.
yeah.
Just because I don't think this is discussed enough. Rachel Rubin, I don't know if you're familiar with her. She's an OB/GYN that specializes in sexual health. She made this new term of genitourinary syndrome of lactation instead of menopause, which we typically see, and the same sort of physiological changes that happen when you're breastfeeding as in menopause. And I think a lot of women don't realize this, so it can lead to like vaginal dryness, and discomfort, and lower like the hormone changes as well, lowering the libido and arousal. So I think also, and then again, partner dynamics when you add a newborn in changes. So I'm gonna add that to my postpartum trauma section.
Yeah.
Might
I
be
love that.
another good one I just thought of. So
Yeah. I love that you added that in. And that's still like maybe the pelvic floor PT can be the support.
yeah, true.
Well, but that's such a great point to bring up because that's huge with the relationship dynamics. And there's probably a lot of pressure on the male side to want to get back to things, but there's so many reasons why your body might not feel great with it. So that's really good to have awareness around. And with that, I mean, you've offered so many incredible tips and insights so far. Are there any other, tips that you want to recommend a woman who's going through, the postpartum phase, particularly if it's her first time going through it?
It's a great question. I feel like the first thing that comes to my mind is that try not to be on social media comparing yourself and just be patient. Give yourself grace. Focus on what you need, not, what so and so eats in a day newly postpartum or how so and so works out newly postpartum. I just think it's hard not to get, a misconception of like what a realistic postpartum body, diet, lifestyle looks like if you're on social media comparing yourself.
Yeah, and I think what is that?
I said, what would you say, Kate?
That everything you're experiencing is somewhat normal, but you should get the support if it persists and you don't have the support. I think just the hormone abruptly dropping after like happy pregnancy is not emphasized also enough. And with the sleep disruption and the raising of the cortisol, these mood swings, this anxiety and irritability, these brain fog, these low libido, all of this is normal, part of kind of physiologically what's happening. And there's a lot of support through nutrition, lifestyle, people that can help you through it. So
Awesome. Yeah, kind of what I heard you say is like give yourself grace.
yeah,
For things are crazy, but also don't just sit around doing it all by yourself because you think it's all normal. Like get yourself the support system, maybe check in with people of like, is this normal? Is it okay? Have some sort of back and forth and people who are really caring for you so you're not having to shoulder all of it.
yes, exactly. Check-ins are great.
Yeah. Well, I appreciate you being here so much. Where can people learn more about Mone Wellness and all of you?
I always like don't talk because I think Kate's gonna talk, but
Oh,
we're online.
you got
You can go to monewellness.com online. You can go to, we're on Instagram at Mone Wellness. We're on Pinterest, LinkedIn, Facebook, Twitter, or I guess it's X now. And then we're in Apple Store and we're on Google Downloads. So, and we do have a hello monewellness.com email. So if anyone wants to reach out and ask us about the app, they're welcome to do that as well. But yeah, thank you so much for having us. It's been nice speaking with you.
Yeah, such a pleasure. And we'll link all the links in the show notes too, so people can find you. Because I do feel like that's such a helpful, it sounds like a really helpful tool for women to even just be able to have those check-ins, have that support at her fingertips, no matter how crazy things are feeling or not. So yeah, and I really appreciate you coming here and speaking to my community. Like we were saying, I think we need to be having more discussions about postpartum and what really is expected, what we should really be doing to support ourselves. So I appreciate you kind of leading that discussion.
Thank you so much.
Thank you so much for having us.